All right, so we're moving to the next form of imaging. All right, next form of imaging. So this is what is known as the radiculography. Okay, radiculography. So once you hear graphy, you know that you're actually dealing with some tomography. You're actually dealing with some imaging stuff already. So radiculography just happened to be like imaging of the spine, trying to access the vertebrae, okay, for their health. So we said that it's an older diagnostic imaging technique. It was mainly used for to observe the spine, and in the spine, we are trying to observe the nerves, not any other thing, okay? Because the nerve roots, they come out from the spine like that. So you can use it to dictate all those conditions that will actually affect those nerve roots. Disc herniation, nerve compression, So it involves injecting contrast because, of course, nerves are not bones that you just see them very clear on the x-ray. Before you can actually see a very good picture of a nerve there, it should actually you must have enhanced the image, okay? So radiculography, so that's a medical examination of the spinal nerve roots using contrast radiography. I use it to identify what intervertebral discs that are actually prolapsed, or nerve root compressions, or any other thing that could actually cause issues to those nerves there, like that will now make you feel pain, numb, weak. So method is the contrast dye is injected into the subarachnoid space or around the nerve roots. Then you follow it with normal x-ray, but because you have injected a contrast, the images there will still be crystal clear. Okay, so clinical application, it was used before, okay, but right now we use more of what MRIs, so you can use to diagnose all those herniated discs, spinal stenosis, nerve root compression syndromes, and the rest of it. So modern relevance is rarely used today because MRI has largely replaced it. So these are just the advantages and the limitations. Okay, so this is what we got for radiculography.